last but not least, we have honored to invite Professor Fan Yimeng here. Professor Meng, he's a board member of ATCM, also chair of Education Committee of ATCM. In the meantime, he's also course director of acupuncture of the Lincoln College. Welcome, Professor Meng.
Thank you. It's a great honor for me to sit here to listen and share the knowledge and experience Professor Shulan Tang is going to give to us. I think you all know her very well, better than me. Especially you are from the same university, you know each other better. So I don't think I need to spend much more time on this introduction. She is the chair of Nanjing alumna of Europe and UK, and she's also visiting professor, and she's the head of the Shulan College. She has been practicing and teaching for more than 20 years. And finally, I think we are good friends, and we know quite well about what we are doing in the Chinese medicine and promoting Chinese medicine. Now it's time for Shulan to give us the inspirational and wonderful talk about a topic in cancer, prostate cancer. Thank you very much.
Thank you, Fei Yi, and Wei Xiang, and everyone. Good afternoon. First of all, I'd like to thank you for your patience to stay until last. Now, let's discuss on the prostate cancer in TCM. Prostate cancer is one of the most common cancer in Europe and in the world for males. Yeah, it's male condition, and it's the third most common cancer overall. Within over 40,000 new cases are diagnosed each year in the UK alone. So it's quite a large rate of the occurrence of the disease. About the prostate cancer, there's about 40% of males over 50 years old of the age can suffer from different stage of prostate cancer. Some of them are on a small degree, don't show too much symptoms. 8% of them show only significant clinical symptoms, and 30% cases are fatal. Because the prostate cancer is a slow developing disease, with some cases only show the signs and the significant symptoms after a few years, sometimes can up to 10 to 20 years suffering of prostate cancer, and then show the symptoms, and patients just realize they are suffering from prostate cancer. So a lot of time, people only notice the diagnosis when the prostate cancer being transferred to the lung and the bone. For sometimes the patient have severe pain in the bones, the spines, and all over the body, or short of breathing, or cough, and the cough of blood. So when the symptoms showing out to the lung and the bone, so at this stage, most of the prostate cancer being diagnosed. So we understand why is that? Then because the prostate cancer, the location is in the prostate gland, and it's near, very close to the blood. The blood stores the water, and the lung is the upsource of the water. So therefore, this disease can be first transferred to the lung, not the other organs. And also, it can be easily transferred to the bones because of this blood and kidney are very close, externally and internally in China relationship. So, and the kidney control the bones. So therefore, the prostate cancer can affect the blood and the kidney, and later show on the bones. So anyone, like especially men after 50 or 60 of age, you have the pains, severe pains especially, you need to be very much aware of the prostate cancer. So this is a modern name and Western medicine diagnosis name. But in thousands of years ago, in Chinese medicine, in ancient TCM book, they are only described as long bi. This long bi is blockage of urine, and the lin zing is like urine problem. Yeah, just continuously. Or xu liao, the blood in the urine. Xu is blood. Yeah. So the main symptoms of the prostate cancer, first of all, it's showing in the urine. If they may, after 50 years old, if they see frequency of urine or urgent of urination, or see the blood in the urine or retention of urination, all sorts of, or keep dropping of the water. So that's all sorts of water system symptoms. It's better have a checkup. Yeah. So that is clinical symptoms. And then nowadays we have the laboratory examinations. We can have a lot of examinations, but one of the main tests is a blood test. And also among the blood tests, we have to classify on the PSA, that is the main cell of the prostate. So normal PSA should less than 10. If they over 10 mg over ml, and then there's half chance, 50% of the possibility of prostate cancer. So that if we see a man, they have frequency urine, have urine problem, and then a blood test, and then so showing the PSA levels are higher. So that is we need to treat for the prostate cancer. Prostate cancer, there's different stages, and normally we look at for 4 stages. And so because of time, I'm not going into details of the different stages. We can understand that if stage 1 is a mild stage, stage 4 is a light stage. And the causes of prostate, and in the Western medicine, the modern Western medicine, they can say that the prostate cancer cause is not very clear, still unknown. More likely, they think there's excessive calcium in the prostate. Excessive calcium can cause the prostate cancer or enlarged prostate. But in Chinese medicine field, but we don't think it's as hard to understand, because TCM considered the prostate as an extraordinary organ, full organ, it's not one organ. And in TCM, all full organs has to be soothed and emptied and removed, like a river. They always have to flow, and all the strong organs have to be stored. So therefore, for prostate cancer, if there's over intake of the high protein food or calciums, or there's too much damp heat or chi stagnation, and that is linked about the liver chi stagnation or the heart emotional problem, blood stasis, or the improper diet causes spleen problem. And then finally affect the kidneys, qi transfer qi to support the blood and the prostate's function. So that's all the organs can be linked together. So when we treat prostate cancer, it's not only look at prostate, but we have to see the blood, lung, kidney, liver, heart, and spleen. There's all can be connected. Yeah. So for the treatment, so in the Western medicine treatment, so it's very common. So the surgery remove at early stage of prostate cancer. If we diagnose it earlier, so we can have surgery removed. But at late stage, it might have to have radiotherapy or hormone therapy treatment or chemotherapy treatment. So, but this all can occur a severe side effect. But TCM treatment, this is my patient over there, Carol. It's you. Yeah. And I don't think I'm going to say you have prostate cancer. The wild Chinese. This is why Chinese medicine diagnosis, to treat, And also the method of treatment. TCM including Chinese herb medicine, acupuncture, diet, exercises, or acupressure, even guasa cupping. So because of the prostate cancer is a modern name of disease, so in the TCM textbook, there are nothing really written as other problems like have different differentiations. But here, over the clinic experiences and observation, I summarize the all clinic patterns of the prostate cancer. I make the differentiation, and therefore follow that. We set up the treatment principle, and then choose according the treatment principle. We choose the herbal prescriptions and herbal ingredients and acupuncture points for and herbs for internal taking and external use. This is all my theory of the prostate cancer, just to share with everyone here. The first step is damp heat in lower jaw, because the location of the prostate is in lower jaw, and the lower jaw is more easily to see the damp and heat. I think here we are all already, everyone is expert and have clinical experiences and practitioners here, and or you have your own successful clinics. So I'm not going through all more details because Professor Fan Yimeng only not allowed me have too long talk. So this is the details. Maybe I will share on the WeChat. And if like all Chinese people very popular is WeChat. If any non-Chinese practitioners, I really suggest you set up WeChat to join our chatting group.
Professor Shulan now suggesting to convert to her time to be her follow. Then you will see her talk about her secret of success online, free of charge.
Free.
In the evening. Thank you for the offer.
Thank you, I will do a lot. And second type, the kidney iron deficiency and damp cold. That is cold type. During the day, lots of doctors mentioned, like Dr. Ranjin said, is warm. So they are most of cancer because of cold and damp and stagnation. So the theory comes because sometimes you see some cancer, like thyroid cancer. So if you take it out, and it can resolve under the sunshine. So therefore, we see it's a more cold stagnation. So the warmth is good. So don't eat too much ice or too cold food. And the third type is spleen tissue and damp, because this relate to the dampness so much, and spleen has a function in transforming and transporting the water and dampness. So this is all the treatment and treatment principle, prescriptions, and acupuncture points. The fourth type is lung qi deficiency with phlegm stagnation, and then can affect. It's because lung can connect to the large intestine and then blood and prostate. They all together linked. And the fifth type is qi and blood stasis. That can be a little bit in the middle stage of the prostate cancer, and there's a little bit even more is lumpy. For clinical exams, if you use finger press from the back passage, you can feel very hard lump at this stage. So the treatment principle there for move the qi and blood. And sixth type is the qi and blood deficiency. That is usually you can see in the quite late stage. And the patients not only suffering from prostate cancer, maybe they already had surgery or radiotherapy or other treatment cause the qi and the blood deficiency. And the Western medicine term is like, we can say it as a low immune system. So we have to tonify the qi and the blood. And seventh type of the prostate cancer is the qi and yin deficiency with empty heat. This is considered very late stage of the cancer clients. So because in the clinic I see if there any cancer patient have radiotherapy or chemotherapy treatment, that easily cause more heat in the body to consume the body yin, to cause the qi and the yin deficiency, and with the heat or even low fever. That is all the 7 types of differentiation of the prostate cancer in the clinic. And this is, in the details we can learn more later, we can discuss it later. Yeah. Finally, I'd like to make a little bit summarize of the treatment of prostate cancer. So first of all, the early diagnosis and the treatment is very important, because the prostate cancer is not like breast cancer. It's the woman, before they really suffer from breast cancer, if they feel the lump, they start panic and start treatment. But the prostate cancer, people not as often can be checked. So therefore, we really need, I really suggest everyone, all the men over 50 years old have regular checkup for your prostate condition, yeah. And if any symptoms or blood test showing abnormal, we should have immediate treatment. But before the prostate cancer, just like breast cancer, so patients may have prostate problem, may not really necessarily have the prostate cancer. Very commonly, often we see men may suffer from prostatitis or enlarged prostate. So in that case, Chinese medicine is very good for that. One of these formula, 前列康片, prostate in Chinese is called 前列腺, 前列 gland. So therefore, 前列康片 is very good look after men's prostate to reduce this enlarged prostate. So very good. And another formula is like 冬柠草片 is one of my common used and one of my favorite formula to treat the cancer patient, especially for the prostate cancer and the breast cancer or non-cancer and liver cancer. So this one, at the early stage of prostate cancer, or we only see a abnormal cell, not the really cancer cell yet. The 冬柠草片 can fight the cancer cells. But at the late stage of the prostate cancer, this can help and support the other treatment like radiotherapy or surgery for during or before or after Western medicine treatment. So this is a good formula. And fifth, the prostate, because has so close relationship to do with kidney. So therefore, apart from the appropriate diet, also for prostate cancer, for a man should regulate your regulate the sexual activities. TCM says if over-sexual activities can cause kidney qi deficiency or cause the tiredness, backache, or lots of other symptoms. But totally stop any, like middle-aged men, if you totally cease your sexual activities. Like in China, in the evening book, described like a man, single man. So they don't have much sex, so they easily to see cause the prostate cancer, because the prostate glands is not working to secrete the liquid or to carry the sperms as it should be. So Also here I like to introduce some herbs, linzi, which is not only for prostate cancer, but for all the cancers. And in China it's very popular, so the linzi can cure the cancer patients. It means all cancer patients should have linzi. But in the morning, Dr. Zhao mentioned linzi can strengthen the immune system. He recommends linzi only can be used at the late stage of cancer patients. So when their immune system is low, linzi is a help. And but my view, yeah. Sorry, I think linzi because it's neutral and it's on the Bentao Gamo. They are listed. There's five color of the linzi. There's red, purple, black, and white, or yellow, all sorts of linzi. And the purple one go to heart. But here we treat the prostate to those kidney. We normally use black linzi. Linzi also we call the magic herb, can save the life. It grows in the high mountains and deep valley, and takes and is concerned the nature, the heavens, the sunshine, water, and dew. Everything takes all the essence in, and if anyone take it for long term, can become a supernatural being for long living, and also keep you ever young. Yeah. So that is linzi. So therefore, and also linzi has another function, is to the black linzi can regulate the old passage and tonify the kidney qi and opens all the blood and heart and all the orifices of the human body. So long-term take linzi can be beneficial for more or less all type of body constitution. And in the clinic, I would use linzi for all type of cancer patients, especially at the early stage. Early stage, it may be damp heat, damp cold, or blood stasis, or chi stagnation, or phlegm stagnation. That is, we think, in TCM, we think that is excessive type. But in the West, the immunology might think this is allergic, easily allergic, overactive immune system. So, and then in the late stage, with showing qi and blood deficiency, qi and yin deficiency, and qi, even yin and yang deficiency, is going to die. So that is, we all now understand that is a low immune system. And I think linzi has 2 ways regulating, just like Huang Qi to treat high blood pressure. If your blood pressure high, take Huang Qi may reduce your blood pressure. If your blood pressure low, Huang Qi can raise your blood pressure. Like linzi in the function in the regulating immune system. If your immune system is high, is easily allergic to and are too active, so linzi is also can bring it down, to calm it down, and normally we can accompany to combine with use like 治百地黄丸、加微逍遥丸、辟邪分清饮, this sort of cooling and cleaning formulas. But also linzi can strengthen your immune system. When you're very low immune system, you feel very tired, you have qi and blood tonic, and you will take linzi to help you last longer for life. So, and also dancing is good to heart for blood and other herbs. And Tinghua when they have radiotherapy, we show you like in the Wanzhou showing very severe yin deficiency after the radiotherapy. So Tinghua is good one. But if it's damp, Yi and the Xie is good one. And finally, apart from this surgery, radiotherapy, chemotherapy, hormone treatment, and TCM differentiation, and the lifestyle is also important. So we really have to advise patients to have appropriate diet and fresh air to nourish the lung, and exercises, qigong and tai chi, follow master Xie. And also heart is so important. Have the open heart. This means open heart. You don't let your heart suffer. You have open, like meet friends and parties and singing and dancing and exercises. And also you have positive mind. When your mind is positive, you can fight you strengthen your immune system. You can fight cancer cell or any problems. Thank you very much.
Thank you for your excellent talk and thank you for your challenge with another professor about use of 灵智. Okay, although Shulan said I restricted her talk time, but we still have decent time for discussion. So any questions? So far? Okay, I think you.
You mentioned about external treatment. Can you give us a bit more detail? Where do you put this external treatment?
All the treatment, like external treatment for skin problem, now we use cream. But here, because on the skin, and it's many imagination are created in my clinic. For the prostate cancer treatment, all external use, I use tinctures, like liquid, in Chinese called 茶剂. We don't want to use the cream. 茶剂, the liquid form, is more easily to go inside the prostate. We can rub on the external locally, and also according to the differentiation. If it's damp cold, we use warm one, like air with wine also. But if it's too much heat, we need this cooling one, like 夏枯草. And 茶剂, or if it's damp, we use 薏仁 or 止泻. If she and blood sugar, we use 丹参 or 当归, or blood stasis, we use 乳香 and then 没药 to make tinctures, to rub it 2-3 times a day.
Right. And would we get tinctures from yourself?
Yeah, we can. Yeah, we can have that. Yeah, I mean got that. Yeah.
Shulan can supply that for you.
Yeah, I do that for you.
Free of charge.
Yeah, okay.
Free of charge.
Today or everything.
I think this is so generous. Yeah. Any more questions?
Reassuringly expensive.
Yeah. Any more questions?
No question. Okay.
One more.
You want a question? Yeah.
We would really like to hear a bit more about the what you have just talked. So I heard that there's another conference going on about the male and the female gynecology conference going on, and that's on the 21st of August. There's a conference just on the gynecology, and we've got 30 top gynecologists coming from China, and they'll be held in Manchester as well. So if anyone's interested, please come and see me after the conference. Thank you.
That's very interesting information. We are talking about prostate cancer, and you are talking about gynecology. But anyway, I think Professor Shulan will be there and presenting another excellent topic. And I think it's time to call a close and celebrate our great success of the conference and our great friendship, and it's time to give the time and title to Professor Wang.
Thank you. Dear colleagues, dear friends, as we always say, time flies, but I never realized time flies so quick. So we just met yesterday, and today we have to say goodbye to some of you. So I think it's also information for the organization committee. We have to organize something. The next time should be a bit longer. Then we have more time to stick together to exchange more informations. Personally, as I said, this is one of the most high academic level of TCM conferences in the past decade. Not because we invited these professional lectures, but also we are lucky to have this professional high academic level audience. So also thank you very much for your cooperation. Yesterday, during the banquet, I think some of you won't be there. I did a small quiz. So when we talk about some brand, for example, Philips, not so far from this hospital, there is a brewer company called Heineken, right? So we also talk about red light districts, window girls, or cannabis, or Wishan, it's me. So you have to remember all of this. Of course, we have Van Gogh, Rembrandt. All of these are related to one country, which is the Netherlands. So the year 2017, we've decided we are going to cooperate with the Dutch Association of TCM in the Netherlands to move our Manchester TCM International Congress to Amsterdam. All of you for sure will be warm welcomed. So I give you an official invitation and a personal invitation here. I want to see every people of you tomorrow, next year in Amsterdam. Not tomorrow. Okay, one of the last things I think from the organizations, we organize these conferences, we realize though we did our best efforts, try to organize everything in good order, we know there's always a huge room to improve. So that's very important. We appreciate your feedback very much. So you know, for Chinese colleagues, you have a WeChat group. For Western participants, you have an email of us. So please send back your feedback, your comments, your suggestions. Only by that, we can make it better, we can improve better in the future. Again, thank you for your supporting. At the end, I would like to invite all of my board colleagues come to the front to thank all the people who were here, who are still here. Yeah, next year, that's a good question. I'm actually waiting for some people to ask this. Because you know the special park called the Keukenhof in the Netherlands. So that's a from the royal family there. Every year thousands of people from all the world come to Netherlands for the tulips. Because they only have a few weeks of really blooming time. That will be from the end of April to the beginning of May. So we will fit the time of the Congress at the beginning of the May, so we can enjoy also some good time there, besides discuss TCM, right? So it will be May. Thank you. Thank you very much.
Thank you very much. All speakers, please. All speakers, please.